Good afternoon. While it might not snow in San Diego, the snow is directly impacting San Diego. We have received word that several shipments that were scheduled to arrive this week will not be arriving due to weather constraints that are impacting the entire country. Moderna's primary manufacturing facility is in Michigan and Pfizer's is in Massachusetts. Both of those, along with the routes from there to here, have been impacted by the snow and the weather conditions we're seeing across the country. And so this is going to impact our ability to administer vaccines this week. Last week, we also had a delayed shipment, and while some of that did arrive, last week we literally begged, borrowed, and stole vaccines to keep as much of our system and structure in place as running. And a second set of delays is going to have very significant impacts on our system. We expect as early as tomorrow to begin to have to pause some of our vaccine locations. We also are very likely to have to reschedule appointments. Again, I think folks understand we don't control the weather and we do not control the arrival of vaccines for when they actually get here. And we appreciate everyone's patience. We will continue to monitor the situation. We will adjust. And as a county, we will continue to do everything we can to get vaccines as arms as rapidly as possible. We now, as a county, have administered more than 663,000 vaccines. Again, this continues to put us at the top of counties in the state of California. But we know that the interruptions in supply chain are inconvenient and are frustrating. We're frustrated. We certainly understand that the public will be as well. But again, we ask for everyone's patience as we continue to do everything possible to administer the vaccine. In general, cases continue to head in the right directions. Hospitalizations seem to have stabilized. And even with the disruptions in vaccine arrival, we continue to administer them at a significant rate and clip. And we think this is laying the foundation to move forward in a good direction. But obviously, the limiting factor on vaccines continues to be the arrival of vaccines. We do now have 5 super stations along with 15 community points of distribution. And we think that this network positions us very well, that as the supply chains begin to increase, that we will be in a position to capitalize very rapidly and continue the vaccination movement. We also think that some of these supply chain issues will work themselves out in the next week to 10 days. And so because of that, we do believe and have a high degree of confidence that at the first week of March, we will be able to move into that first tier of essential workers, teachers, food and agriculture, and law enforcement. We think that we are getting to a place where we have reached a significant number of seniors, and as the supply comes in, we believe the first week of March we will be able to do that. This, of course, is subject to change, but right now we do believe that it is doable. The other thing I want to touch on, just as it relates to demographics, and Supervisor Nora Vargas will talk about this a little bit more, but as a county, we've moved fast. Speed was seen as the goal in terms of getting vaccines and arms positions you to get more vaccines if you're better utilizing them. It's also important to note that every vaccine that you put in an arm has a positive public health impact in terms of lowering case counts, lowering hospitalizations, lowering the loss of life. And so we have driven with speed being our goal. But we also recognize that the hardest to reach communities, communities that are historically most disconnected from healthcare systems, communities that have the least technological ability to connect, communities that may have traditional language barriers and others, these folks are harder to reach, meaning that it takes more time to get to them. If speed is your goal, you have to be very conscious and intentional about working to ensure the vaccine is available to all. And we are working incredibly hard and putting in place a lot of effort and a lot of systems to try and do this. But the simple reality is we recognize that we have to do better. The South region, as Supervisor Vargas will talk about, is second in terms of number of vaccines administered per person. But again, we know that those communities that have been hardest hit need and deserve the vaccine early. We've also been limited a little bit by the demographics around healthcare workers, which do not represent the county as a whole, nor do they represent at all the number of cases, which are predominantly cases tend to be younger folks. And seniors, again, more reflective of the community as a whole, but certainly not right in line. But we are going to continue to work every day to try and improve our efforts, increase access, and do everything we can so that some of these harder to reach communities have access. In that spirit, Supervisor Vargas will walk through a program that we have launched, program SAVE, scheduling assistance for vaccination equity. We have 9 community groups that really represent and work with some of the most hardest hit communities, and they have been trained and have the ability to directly schedule folks for sites. We are prioritizing those vaccination appointments and sites, and if they find folks, they will have the ability to make sure that they get scheduled. So we've blocked aside vaccination appointment sites for these community groups to sign up folks from their community. And starting next week, we will begin sharing with you how many appointments each of these 9 groups have made, both in total and on a weekly basis, so we can show the impact of our efforts around doing it. These groups in the community know the community best. They know where to go. That is why they've been brought on board to help us with this program and ensuring equitable access to the vaccine. We've also had some success in particular with our Black Nurses Association. We are expanding those efforts with our Filipina Nurses Association and our Hispanic Nurses Association, again, giving them access to vaccines, to appointments, and working to make sure that we are doing things in an equitable way. And then mobile teams are already out visiting locations where seniors most frequently live in the hardest hit communities, and we think that there will be more opportunities once we get through long-term care facilities and we get through skilled nursing facilities to put more mobile teams to work in the community. We have made significant progress. 1,174 of our long-term care facilities have been visited for vaccinations. There are 173 that are left, but all of those are scheduled in the coming days. We do not anticipate those will be impacted by the supply issues. All 86 of our skilled nursing facilities have had their first dose. 84 of them have had their second dose. And so this week we will complete the work at all of our skilled nursing facilities and again get to the work of finishing our long-term care facilities. And as the mobile teams that are doing that work wrap up that effort, then they can be redeployed and put back out into the community. We've also launched a number of individual programs. One I just want to highlight is a partnership with Serving Seniors in St. Paul's Pace, giving a vaccination clinic at the Serving Seniors downtown Potiker senior residence. This pilot was successful, and especially those with mobility challenges going to where the seniors are, and we want to continue to expand this model and replicate it and get to other places. And final thing for you is just 211. I wanted to update you on some progress surrounding 211. Between February 1st and February 16th, 13,575 callers requested to speak to someone about vaccine. 90% were answered and connected with a real person with an average wait time of 1 minute and 31 seconds. That includes both English and Spanish speakers. And again, these folks were plugged in and have the ability to be connected directly to an appointment that they can schedule for them over the phone. Seniors who do not have transportation have access to a program that will pick them up and take them there. And seniors that are homebound are being placed on a waiting list for our homebound program as they get out and work through those seniors that are there. And the stats for Tuesday, just yesterday this week, they were able to answer the calls with an average of 18-second wait time. Again, both English and Spanish, and so we do think that the increased staffing there is generating some positive results. And again, we appreciate everyone's patience as we get all these programs stood up. With that, let's jump into our quick charts, and then we'll hear from Supervisor Vargas. What you see right here is just an update on our vaccine supply. 765,500 total dosages have been received in San Diego County. Of those, 663,194 have been administered. These are shots put in arms. We have 3,783 that have been administered. Their pending documentation just means that information is getting added into the system, and they will be added to that. And then you see the 98,523 doses to be administered. Those are just upcoming appointments, and those are ones that we know are coming on the way. And again, this is where you see we're running very, very lean in terms of dosages that are available and accessible, and so any interruption in the supply chain obviously has a significant impact. More than 17% of the population has received at least their first dose, and 5% of the population age 16 and older are fully immunized. Our cases, again, continue to trend in a good direction. 539 today. You see the last few days we've stayed under 1,000 minus the 1 day on the 10th there for a considerable time frame, and this is encouraging. This will help us as we work to descend in tiers. And again, we encourage everyone that there's a natural sense of as things get better, people lose their focus, and when we lose our focus, then things aren't better anymore, and they start getting worse. And we want to get out of the roller coaster of up, down. We need to keep doing the things we've been doing to bring these cases down, and let's continue to make forward progress. On hospitalizations, again, you can see kind of a stabilization would probably be the best way to describe it. It doesn't match the downward trajectory in cases, but again, there's a lag in terms of what we see in hospitalizations and what we see in cases, with hospitalizations lagging afterward. But again, much better than where we've been. And then on ICU availability, you begin to see a little bit more availability there. Obviously, the COVID-related ICU numbers are coming down. The non-COVID numbers are going to increase as they catch up, but we're seeing more ICU beds staffed and immediately available than we have in a fair amount of time. And then the ever-present reminder that COVID is still with us, it is still real, is today reporting 57 additional deaths are being reported today to bring our total to 3,099. This is a reminder of why we continue to prioritize and focus on vaccinating seniors to try and most quickly affect the loss of life from COVID-19. Final chart for the day is encouraging. Again, this is just showing our case counts descending, unadjusted case count, adjusted case count, testing percentage of positivity. All of these are headed in the right direction, and if we can continue the work we've done, which means continue the efforts we've taken, then we will be on a trajectory to hopefully in the near future descend into a lower tier. With that, let me turn it over to Supervisor Vargas, and then Dr. Wooten and Dr. McDonald are both here for questions.
Good afternoon, and thank you, Chair Fletcher. For the last couple of weeks, we received feedback from our community members who are concerned about the low percentage of vaccines that have been administered, specifically to communities of color. With healthcare equity being our top priority and at the core of everything we are doing here at the county, I do want to mention that some of the innovation programs that are in place now and some that are being planned to ensure that these percentages are starting to move up. A couple of weeks ago, we announced that we were expanding the capacity of 211 to assist first with securing appointments for individuals 75 and older. And as of last week, as the chair mentioned, we are also assisting those 65 and older. That has had a great impact, especially from the equity lens in communities in South County. We know that some of the hardest communities that have been the hardest by the pandemic are in South County. And so I want to share with you the chart that specifically identifies individuals who received COVID-19 vaccine and where we're at. And so as you can see, number where it says South, right, there's 100, the number of individuals who have received COVID vaccine now, South County is now in second place. And that's an important, it's important to note that because as you can see, we have now increased the number of people in South County that have received the vaccine, and it has, we believe, a lot to do with the intervention programs that we have been able to really continue to provide resources into that. Into one of them, what we know is that specifically from Chula Vista, Otay Mesa, and National City, a lot of folks have actually been calling 211, and we're going to continue to share that information so that anybody who's older than 65 years or older is able to call 211 and get their appointments made for them directly. And so this is helping, and we know that this is important. The other part I think that's really critical, and it's another slide that I'm going to share with you that specifically talks about Project SAVE, which really is about the scheduling assistance for vaccine equity. As we mentioned before, when COVID hit, the county partnered up with a lot of the community organizations that are the safety net of the community. And what we've done is we continue to invest with these partners to make sure that these organizations that are working closely with the community have the resources that they need so that they can help us, and now are going to be pivoting to be able to make the appointments themselves. This is important because now more than ever, we know that we can't do this alone. Government can't do this alone. This has to be a partnership between our community organizations and making sure that every neighbor is getting an appointment as soon as the vaccines are available. One of the things that we will be providing to all of you is that we're going to be sharing next week a dashboard that's going to keep track of our efforts with our community partners. Right now, San Diego State University Promotor Program, they have a Promotor and Community Partner Program that is out there actually making the appointments for our communities. South Bay Community Services is making the appointments. And the other organizations like the San Diego Latino Health Coalition have been asked to pivot their work and actually make the appointments themselves to our communities. This is extremely important because these are trusted organizations that our community know that they can trust, right? So with our need to ensure access, we're asking these community organizations to do this work with us, and this program was launched 2 weeks ago around the Promotora program. I actually had the honor of running one of the largest promotor programs in the West Coast in my previous role as an executive for a healthcare organization. And I know exactly how these promotoras programs work and how the impact that they can really have in our community. And so we are going to put a lot of our resources and efforts to make sure that these promotora programs are working. We're going to make sure that we're going to continue to work with our community partners. I also want to share with all of you that we are happy to share that SDG&E and Cox Communications have stepped up and are going to be partnering with us to ensure that they are including vaccine information into their bill inserts, so that it's another way for us to be able to get information into our communities so that people understand how important it is for them to get the vaccine. So we're grateful to our corporate partners. And in addition to that, all of our public assistance programs are going to also have information directly around the vaccine so that people get vaccinated, as things are moving pretty fast, as the chair has said, and so we want to make sure that all San Diegans are able to get their vaccine. Como muchos saben, nuestra región continúa enfrentando retos con el suministro de vacunas debido al impacto del clima en los envíos y otros factores. Para aquellas personas que no saben, las tormentas de nieve en el oeste han impactado mucho, en el este, perdón, han impactado mucho, y por eso es que ahora hay menos vacunas accesibles a la comunidad. Sin embargo, quiero mencionar que continuamos abogando por vacunas adicionales ante el gobierno y el estatal federal. Durante las últimas 2 semanas hemos creado intervenciones específicamente para aumentar el número de vacunas en el condado del sur de San Diego, que es el que ha sido más impactado por el COVID. Es importante demostrar que para nosotros la equidad de salud es lo que nos está enfocando para poder crear esas intervenciones que van a tener un porcentaje más importante. Y como pueden ver aquí en este documento que está, se pueden dar cuenta que en el sur del condado de San Diego estamos en segundo lugar en cuanto al número de individuos que están recibiendo la vacuna durante esa época. Entonces es importante mencionar que el número está cambiando y ya llegamos a segundo lugar específicamente por las intervenciones y los recursos que se han invertido en nuestras comunidades. Hace un par de semanas hablábamos de invertir en la comunidad y con las comunidades que hemos hecho el trabajo. Una de ellas es, next chart please. Una de ellas es el programa que tenemos para ayudar asistencia de vacuna para crear equidad con nuestras comunidades, ¿verdad? Entonces, lo que hicimos fue, ya estábamos teniendo recursos con las comunidades, ya teníamos el trabajo con ellos, y ahora ellos están haciendo las vacunas para las comunidades. Ha sido importante este trabajo porque lo que ha hecho es demostrar que, pues, cuando la gente sabe, les podemos ayudar para que hagan su cita, sí van y hacen cita para vacuna y la pueden usar. Entonces, organizaciones como la Universidad de San Diego State, organizaciones como el San Diego Latino Health Coalition, la coalición, ellos están trabajando con nosotros y ahora van a empezar también a ellos tener la oportunidad de no solamente hacer las citas, pero ayudarle a las personas para que puedan hacer su cita para la vacuna. El otro, thank you very much for the charts. Lo último que quiero mencionar es que el 211 ahora sabemos que sí está ayudando a las comunidades, entonces les pedimos a todos los medios de comunicación que enfaticen que la gente puede hablar al 211 si tiene 65 años o más y se les puede ayudar específicamente a hacer su cita para sus vacunas. El condado está invirtiendo muchísimo dinero ahora porque sabemos que es importante que la gente tenga ese acceso. Entonces, más que nada, también quiero mencionar que cuando las personas reciban sus comunicaciones por medio de del San Diego Gas and Electric y del cable, van a empezar a recibir ahora información sobre las vacunas, en dónde se pueden vacunar y más información factual sobre la vacuna también. Así que estamos agradecidos con las corporaciones que nos están ayudando y nos están apoyando, y ante todo vamos a seguir haciendo todo lo posible para que esta información salga a las comunidades que son más impactadas por el COVID, para que las personas puedan tener acceso y se puedan vacunar, y siempre con un lente de equidad. Muchas gracias. Thank you.
Thank you. We'll now go to our call-in questions.
Okay, our first caller is Chris Beal with Fox 5 News.
Hi, Supervisor. Just wanted to touch base on what seems to be us going to the less restrictive tier, according to the governor within weeks, and how the county is looking ahead to that. And then secondly, every time we've done the tier system, one red tier from 3 months ago does not look like what it could look like tomorrow. So any nuances that you might see or expect?
Yeah, I'll have Dr. Wooten share thoughts on potential movement of tiers.
Good afternoon, everyone, and thank you for that question. If our trend continues in the pace and pattern that we are achieving, we could, that we've been seeing, we could expect to be in the red tier in a couple of weeks. But again, that's if things continue in the same trend. And with the red tiers, they're all on the state's website as opposed to what is open or allowable in each of the tiers from purple, red, orange, and yellow. So we would abide by the guidance that's on the state's website for what is allowable in red tier. Does that answer your question?
Yes, thank you.
You're welcome.
Let's go to our next question.
This next question is from Derek Stahl with 10 News.
Hi there. I have a vaccine logistics question. So in recent days, we've seen sort of an uneven supply of doses at vaccination sites within the county. We're seeing Petco Park shut down, while Sharp locations seem to have a sudden influx of doses. I think there's a perception in the public that the county basically gets doses and then distributes them to different sites. And so there's some confusion about why there's this uneven supply at county coordinated locations. So Can someone explain how doses are actually allocated to providers and why there is this unevenness?
Yeah, the unevenness is primarily due to there being two different vaccines. So one site will only administer one vaccine. So in the two examples you gave, the Petco site is administering Moderna. The Chula Vista site is administering Pfizer. So when we miss a shipment of Moderna, then that impacts one site. That does not impact the other site because they're two different vaccines that often get shipped. Well, they do get shipped separately. And so the real fluctuations that you see there is just based on the availability of which vaccine you're receiving and which one you aren't.
Yeah, that's a great answer. And then county staff also mentioned to me earlier that it also may have to do with providers like Sharp and Scripps getting different allocations. They're drawing from different pots, and so they mentioned that they get a county allocation, but also they get an allocation directly from the vaccine manufacturers, and that seems to make things complicated. And I'm just wondering why the system was set up that way, and what will be the impact of Blue Shield taking over?
For why the system was set up that way, you'd have to ask the people that set up the system that way. At San Diego, we deal with what we get. We did not design the vaccine distribution system. And so, I'm not trying to put it off. We just didn't build it that way, so you'd have to ask the folks that built it that way. We do, I will say, have generally very good cooperation with our healthcare providers. So they may get their own dosages for their internal use, and then we supply dosages when they're staffing a pod. But they've been very flexible and very willing to loan some of theirs to help bridge us through, and we have worked very, very collaboratively there. And so we're figuring out how to make the system, as it is designed, work a little bit better so we can get things quickly in arms. As it relates to Blue Shield, we don't know exactly what will happen. I spoke again today with the CEO of Blue Shield, and I think they understand our situation, and I think that they're certainly not going to try and disrupt a system that by and large is generally working. So, we'll just have to wait and see. I think we'll be briefed in the coming days on kind of what their plans are and what they will do. But I think everyone has the exact same goal and the exact same mission, and that is to get vaccines in arms as quickly as possible. And so I don't think there will be anything that will disrupt that spirit.
Thank you, Supervisor Fletcher.
Thank you.
This question is from Mimi Alcala, also from 10 News.
Yeah, hi. So the state has said starting March 15th, healthcare providers can begin offering the vaccines to some of the people with specific medical conditions. Some health systems say they're waiting for county guidance. Will this be happening in San Diego County in March? And if someone does not have a healthcare provider, will they be able to go through a county site to get this?
Yeah, I'll let Dr. Wooten address that, but I think the plan is, March 15th, that we would, again, it's all dependent upon supply of vaccines in terms of how many appointments are there. But I think that there is a great value in adding. We think at the very beginning of March, we'll be able to open to that first group of essential workers, and then we think consistent with the state guidance at March 15th, we'll be able to open up appointments and slots to individuals with underlying health conditions. But again, how quickly you move through all those is dependent upon the supply. But let me, Dr. Wooten saying that's good. So, yes.
Okay, great. And a quick follow-up, do you guys have any idea how people would be able to prove that they're eligible?
Well, I think it would probably follow the same type thing now. If you're a healthcare worker, you have to provide some documentation that you're a healthcare worker. The same will be true when we get into other categories of essential workers. And I think most people that have an underlying health condition will have some corresponding ability to show that. It will be
Thank you so much.
most easy for healthcare systems that are doing those internally because they have folks' records, and so that's probably where the bulk of them will be done. But we'll certainly try and do everything we can at our network to help as well, again, dependent upon the supply.
Thank you.
This question is from Jamie Chambers with Fox 5 News.
Hi, Dr. Wooten. We're getting some questions on whether or not someone that has had their second vaccination and they've been there for 2 weeks, are they transmissible even though they theoretically are not really able to get the COVID-19? I was wondering what you were seeing from a county data point is if someone's gotten the first vaccine and then the second vaccine, had their second 2 weeks out, are they still a potential vector for other people? Just from the data standpoint, what you guys are looking at. I know everyone should wear their masks, but are they still a vector even after they've been completely inoculated?
Thank you for that question. We have not studied that locally, but nationwide, the manufacturers actually and other national researchers are looking at that very thing. We don't know exactly yet. Right now, the thought is that it is possible if someone who has had their 2 vaccinations and they are past the 2-week period, they could become a reservoir, if you will. But we just don't absolutely know that to be the case. So that's why more research is going on.
And then one other thing, are we seeing the effects of the first responders, the medics, the doctors who have got the vaccine early? Are they having any issues from a transmission standpoint to themselves, or are we seeing the efficacy as high as 96% in some cases? Are we seeing that? Is that data holding true?
I am not aware of any infections in emergency medical services workers, paramedics, EMTs that have been vaccinated, received their full 2-course courses of the series. So I don't know the answer to that question at this point in time, but we will look out for that, and if we see a pattern and an increase association, we will certainly look into that very seriously. But right now, we don't have any information related to that. Dr. McDonald is walking up to my side here, and he might have additional info to share.
I think that there's two pieces that I wanted to pass on. One, we know that the vaccine is not perfect. It is very good at preventing bad outcomes from COVID, that is death and hospitalization. But very small percentage of individuals we would expect actually even getting their full vaccine may come down with symptoms and in fact potentially be contagious with others. So we will learn about that over time. Actually, just within the last couple days, we learned of our very first case of somebody who has had a full series, a healthcare worker, as a matter of fact, who did come down with COVID, actually had minimal symptoms, was known to have been exposed, got tested, and sure enough was positive. And we're looking at those cases by analyzing them by whole genome sequence to see what relationship that has to the vaccine. So we have had our first case reported in the last 48 hours. We do expect more. We expect the number to be low. We expect most of the cases to be the one that was just reported, which is essentially minimal symptoms.
Thank you, guys. Really appreciate that. That sounds good.
Thank you. We'll go to our next question.
This question is from Bianca Bruno with Courthouse News.
Hi, this is probably for Supervisor Vargas, so if Chair Fletcher might have information, I'd expect he could chime in. But Supervisor Vargas, you met yesterday with the Consul General of Mexico to discuss combined efforts on COVID-19, and San Diego Mayor Tongoria also met with the Tijuana Mayor to discuss the same thing. The vaccine doesn't stop at the border, which people are still crossing for work. So how is the county planning to work with public health officials across the border on a binational vaccination plan?
Thank you for that question. Just like last week, I also met with the Director of Health for the state of Baja California, and we understand that over 200,000 U.S. citizens live in Baja, and so we are counting them as part of our bigger component in terms of the vaccination distribution in our region. These are American citizens who live in Baja, and so we want to make sure that they get their vaccinations. I think we continue to have conversations about the impact COVID has had, particularly in the binational region, and so we're going to continue to work together and have that dialogue as we're trying to address the vaccination need beyond South County and also in Baja California. But they are not yet vaccinating their population at the level that we are, and so there's still a lot of work to be done. Thank you.
Go to our final call-in question.
It's from Paul Sisson with the San Diego Union Tribune.
Thank you. Gotten some outreach today from folks who have been, they say, waiting a long time in line for the Petco vaccination site today. So I wonder if anybody knows why that is, what's going on at Petco. I know that they reopened today, but yet it seems like we have a somewhat limited vaccine supply. So why the gridlock at Petco?
Yeah, I don't know, Paul. I haven't heard of that, but we can certainly check into it and get back with you.
And then a second question involving second doses. You talked about the winter weather freezing the national vaccine supply. That makes a lot of sense given what we've seen in the news. I wonder, though, how many second doses are currently on the books that the county is looking to reschedule, and in general, over the next couple of weeks, how many second doses would people generally require given the normal timeframes for these two vaccines? I
mean, I think we would have to look at pending appointments, and then again, we're we're trying to shuffle and readjust to try and fulfill as many appointments as possible. So I don't know today exactly how many second dose appointments will need to be rescheduled. We do obviously prioritize second dose. But Paul, the broader issue, I think, is a really important one as we think about the next few weeks of vaccination in particular, is when you look at the number of vaccinations we've done, more than 664,000, and you look at the difference between first dose and second dose, you can see how many second dose appointments are going to be coming and how many of those are going to be coming due at a point where we have fewer vaccines than we had at the outset. So it certainly shows that there will be tremendous strain on the system to fulfill second dose appointments, which means barring some significant change in supply chains, the availability of first dose appointments for the next week to 10 days will probably be fairly limited. So, I think in terms of exactly how many second dose appointments are going to have to be rescheduled, we're not there yet. We're still trying to adjust and figure out how we can meet the need as best we can. But there are a significant number of second dose appointments that are going to come due in the coming month. And we're, again, counting on and hoping on the supply chain to increase at the beginning of March.
I guess I wonder whether folks who are in charge of this whole beast have some concern that second doses might begin having to be administered beyond the 6 weeks recommendation that the CDC has put forward. Are there concerns that you might have to do revaccination?
I don't think I'll let Dr. Wooten touch on that, but I don't think we're in danger of missing the 6-week window. When we're rescheduling people, it's generally they're right at the 21 or 28-day mark, and if we have to reschedule them, they're usually rescheduled, within a few days. So I don't think we're in any peril of having second dose appointments go 6 weeks beyond that. If nothing shows up for 6 weeks, then it would be a different situation, but I don't expect that to be the case. But let me let Dr. Wooten address that.
Paul, I really don't have anything else to add. The weather has put a delay in vaccines being received to the region, but I anticipate beginning next week things will begin to get back to normal. And recall that Johnson & Johnson will be up for review on Thursday, the 26th, and that is going to create a pipeline of vaccines all across the nation and into our region. So I think we'll be fine. Regarding the actual time, CDC did issue additional guidance, as was stated, that 6 weeks after the first dose is allowable. But they also say that even if it's after that, you still should be fine and should not be required to start this series all over again. So I think people will be fine. Thank you.
Thank you, Doctor.
All right, let's go to our text-in questions.
Okay, this first question is from Nelly Cervantes with El Imparcial Tijuana. She asks, will local clinics who serve low-income and immigrant refugee populations be included in the plan to vaccinate local residents?
Yeah, all of the federally qualified health centers, clinics are in the plan to vaccinate folks, and we do work with a variety of partners. In particular, those partners we think are best equipped and best able to meet the communities most in need.
Our second question is from Chris Genuine, Times of San Diego. We're getting reports of people with tenuous connections to healthcare and other essential services getting vaccinated ahead of others. What is the county doing to keep the vaccination sequence fair? Yeah,
we put in place a series of protocols where if someone says they're a healthcare worker, they have to produce documentation at the vaccine site that validates that. And we have turned away large numbers of folks who don't meet that threshold and are not there. Out of 664,000 vaccines, is it possible that someone generated some false ID or fake document or pay stub? It is possible. We don't stop to independently contact the employer to verify that, because if we did that, then we wouldn't be able to do the numbers that we're doing. So it is possible that people have slipped through, but each of our sites do the best they can to keep people honest and hold to the tiers.
This is from Mario Escovedo at CBS 8. Is the county keeping records of how many people are not showing up for their vaccine appointments? Has the county noticed a significant problem with no-shows?
Yeah, we haven't noticed any significant problem. There are always some individuals who don't show up, and we adjust the appointments to accommodate for kind of a standard across the board no-show rate. It's been very low. We've, generally had the opposite problem of more people wanting appointments than we've had appointments available. So we haven't seen a considerable thing. You do see a lot of cases of, one site, people say, well, there's open appointments or, they're not being filled, but generally those catch up and get filled. So we haven't had any significant problems of no-shows for appointments. The much more common problem is greater demand than we have availability.
Marilyn Hyder with Kogo Radio News. Can you update us on the Petco site? Will it remain, or is it moving or closing due to Padres baseball?
Yeah, it is going to, we're going to have to move that operation by the beginning of April. We kind of knew that going in, and so we're looking at alternate superstation sites where we can ensure that the continuity of operations and just be able to pick it up, lift it, and drop it off in a new location. We've got a little bit of time until we get there, and so we'll make sure that that's a smooth and seamless process. But at some point between now and the start of baseball season, we will be moving that facility.
Mike McKinnon from KUSI. San Diego is the most locked down county and the most locked down state in the country. Can you share the science that justifies this?
Yeah, thank you for that question. We have shared the science that justifies all of the public health orders, and you can find all of it posted very publicly on our website.
Jonathan Wozen from the Union Tribune. Can people who got their first vaccine dose at one location get the second dose at another?
Technically, if it's the same vaccine, you could, but we're strongly encouraging people to return to the original site where they got the first vaccine to get the second vaccine. Might be a little bit more convenient, easier, and they'll be familiar with that location, and then they'll also be guaranteed that there'll be no confusion around which vaccine they got. Having said that, though, it is possible for someone to go to a different location, but it's not something we encourage.
And this question is from Laura Acevedo with ABC 10 News. It's several parts. Can you specify how many vaccines you were expecting this week that are now delayed because of weather? And what was the delay with last week's shipment? How many vaccines from last week's delay are you still waiting for?
I don't have the exact numbers. We can try and pull those and get them to you. We don't know what the delay was from last week. We do know the current delay is based on weather. All right, that concludes our briefing for today. I want to thank everyone for joining us. We will be back with you next week. Thanks.